Thank you, Mr. Chairman. And I believe the answer to your very good question, Mr. Chairman, is there is no answer. And later today, Senator Grassley and I, apropos of what the chairman has said, and Senator Bennett are going to introduce legislation to open up the Medicare database. And this is long overdue. I appreciate the thumbs up. Let the recorder note that one of the witnesses gave a thumbs up to that. This is a treasure trove of valuable information. It needs to be released in a way that is sensitive to protecting the personal issues with respect to seniors. But in answer to the chairman's question, there is no reason for not making this public. And I want colleagues to know Senator Grassley and I are going to do everything we can to add this to the SGR bill, because I think it's very appropriate, apropos of what Dr. Ginsburg has talked about, that we get this information. It's going to give us a lot of clarity with respect to practice patterns across the country. And for the first time, people around the United States are going to be able to see what Medicare actually reimburses for various services. And people have been debating this since the days when I was co-director of the Gray Panthers, but I think the answer to the chairman's question is there is no compelling reason for doing it. And with the court's decision as well, I think we now have the green light to get it done. So I thank you all for your answers. Let me ask you about one other area, and that is, my hope is in the days ahead, we will be able to also focus on an area of Medicare that has been neglected in the past. And Senator Casey and a number of colleagues, Senator Isaacson, have been talking about this, and that is chronic disease. This is where most of the Medicare money goes. Well over 80% of the Medicare money in America goes to heart, stroke, cancer, and diabetes. And I would like to have you all outline how you think access to data and improved transparency in the Medicare program in particular can help identify and help treat seniors with chronic disease. So why don't we start with you on that, Dr. Ginsburg?
Yeah, thank you, Senator Wyden. I believe that the best approach to addressing chronic disease is not publishing a lot of data, but to reform the provider payment system, such as through accountable care organizations or similar things. These are organizations that are accountable, they have incentives, and their biggest opportunities are to address chronic disease better than in our fragmented fee-for-service system. So I wouldn't go the transparency approach, I'd go the payment reform approach.
Well, I think, Dr. Ginsburg, and you are an authority in this area, my hope is we could do both. We could do both, and certainly the accountable care organizations in terms of integrating care certainly move us in the right direction. There are some issues, particularly the attribution rule, that I hope, and we'll have another nod for the recorder because Dr. Ginsburg helped us there as well. I think that the attribution rule is also limiting our ability to see practitioners specialize in chronic disease. And if you'd like to follow that up,
yes,
please.
Yes, I would. I mean, I think even though there's a lot of potential in accountable care organizations, the specifics of which the legislation was written and the regulations written may not have been the best calls. And I'd like to note that the Bipartisan Policy Center, when they came out with their strategy, they called for an enrollment model of accountable care organizations where beneficiaries would have incentives to enroll, and that would be a big improvement in attribution over the way it's done now.
Well, you're absolutely right that there are a number of pieces to this puzzle. There are also some questions about which vulnerable seniors are going to get access to a care plan, because the language in the text of the rule talks about people at high risk. And one of the things that's come to light is what happens to people who, say, have 3 chronic conditions. Are they considered high risk? But for any of you, on the point with respect to transparency and chronic disease, what are your thoughts with respect to how various transparency reforms that you've been talking about can help us deal with the area that I think Medicare has been transformed into? There is more cancer, more stroke, and more diabetes than when Medicare began in 1965. And having your thoughts about how transparency can help us tackle chronic disease, Doctor, would be great.
Yeah, so I've been a practicing physician for many years, and transparency, I think Dr. Ginsburg is right. Transparency is not the only solution. Transparency is the beginning. The way I like to say it is transparency is like giving you a great seat to a very bad movie, and we're just starting from there. But transparency is not only transparency on prices. Transparency is transparency on quality. So Medicare can give us data, and the more data we have, the more quality we can pick. When my mother had cancer and I really desperately wanted to find a good quality hospital for her cancer, I couldn't figure that out. And that's an area where Medicare really is still lacking, and it's not fair to American citizens. It's just, as a physician, I find this almost offensive, the fact that we can't understand who's performing better, what are the better outcomes, where do we get the best surgery, and ultimately, what are we paying for?
My time is up, Mr. Chairman, but again, I'm sure glad you asked that question about the database.
Right.